We are all facing an aging population, and I think this really is the pressing, burning platform for us in Singapore, that aging issue. And it really is the main reason why we are going into integrated care, because aging brings with it a whole bunch of big problems, complex ones. We currently have only, just about 10% of our population is age 65 and above, but by the year 2030, 2035, it will more than double. So this is the gamut of issues that affects the elderly, and we arrived at this in Singapore, which is not uncommon. You probably have the same issues here in the UK. We inherited the British system, and in fact, all our doctors, myself included, were trained very much in the British flavour of the day. And essentially, it's a public, private, and a people sector system. Not too complicated. Essentially, 80% of hospitals are owned and run by government. And then the reverse is true in the primary care sector. Then, of course, the long-term care sector, meaning nursing homes, day centers, home care, they are dominated by the NGOs, by the charities that run these organizations. So therein lies the problem. We have got a whole bunch of disparate organizations, all have developed on their own, and essentially it has caused fragmentation. And essentially, at the end of the day, we want it to be a well-integrated, seamless, smooth, coordinated patient care journey, where we have got clinical pathways or care pathways, that help patients with certain diseases across the spectrum, and of course to enable them to stay healthy in the community. We have decided to reorganize our delivery system in Singapore into what we call regional health systems, and essentially it is a healthcare ecosystem in a regional catchment area, serving around 1 to 1.2 million people at any one time. They will be linked by an electronic health record that would be interoperable, and so that information can flow seamlessly from one part of the region to another, because people do move. So this has been a major undertaking since 2004, when our then health minister decided to revamp and transform and reform the entire healthcare system. If you need a standardized way of enabling all healthcare providers to determine whether a patient needs a nursing home, whether a patient needs home care, and if it's home care, what kind of services, what resources need to be channeled to that patient. So this then goes into the development of what we call resource utilization groups, or RUGs. And finally, we mustn't forget that at the end of the day, the backbone of integration, besides the IT system, is really a very strong, robust primary care system. And one of the big movements that we are going through in Singapore is to transform and reform our primary care delivery system to enable GPs to deal with patients with chronic diseases and the frail elderly in a much more effective manner, including developing pathways, including substitution of care from the traditional GP-based care delivery to more multidisciplinary team-based delivery. So, for example, we're now using a lot more nurse educators, therapists, social workers in place of the typical GP consults. We are also having a lot more phone consults in Singapore. I'd like to move now to really more in terms of what are the additional tools and approaches we have used in Singapore to integrate care. And one of the important tools that I'd like to highlight is transitional care. It is a new model, a relatively new model that is now gaining great popularity in the United States, in Canada, in Australia, and many parts of Asia as well. And we in Singapore have embraced it because we think that patients who spend 5, 6, 7 days in a hospital cannot possibly have their care entirely sorted out before they go home. So if the patients are only going to stay just barely a week or less than a week in a hospital, you need a continuing series of interventions for the patient in their homes to enable them to cope. So transitional care addresses that gap, and essentially it lasts anywhere between 1 month to 3 months. And typically the team that is involved are non-doctors. They are typically nurses, social workers, and therapists. And all of these things that are done for the patients has resulted in tremendous savings for the system, because it has resulted in reduced readmissions and unnecessary ED visits, emergency room visits as well. And I'm happy to say that in just 1 year alone, we managed to save about 10 million Singapore dollars just from this program that has affected about 10,000 patients. We need to pace the change, of integrated care, and that's going to be a big challenge, because while it is not exactly a technical challenge anymore, it is also as much a management leadership challenge in terms of how to integrate care. So getting the buy-in, I've been very fortunate in that my ex-minister and my current minister are very, very much in favor of integrated care, despite the fact that the evidence is not entirely rigorous and strong. We need new skills amongst ourselves, collaboration, how to strike win-win deals and negotiation, how to be culturally sensitive, especially in an interprofessional manner. Removing the silos. These are all new skills that I think many of us, certainly in medical school, nursing school, we haven't learned very much of. The IT system is critical, and I know that that's something that you are focusing on here in the United Kingdom. Ultimately, it's about change management. Ultimately, it's about how do you get the rest of your team, on board and to convince them that this is the right way to go, and how do you do it? How do you actually get it done? What are the processes you have to put in place to do all that? Please remember to measure patient, provider, and system level measurements, because that's how you can then convince the politicians to put in more money into integrated care. For us, we measure things like readmission rates, we measure patient satisfaction, we measure both clinical and financial outcomes. And for providers, it's all about basically how efficient they get. But we still struggle today with system outcome measures, and maybe I'd like to look to King's Fund and to the UK for some leadership and guidance on that, because I love to copy you. Thank you very much.
Jason.